Welcome to the Big Unlock podcast, where we discuss digital transformation and emerging technologies in healthcare. Hear some of the most innovative thinkers and leaders in healthcare and technology talk about how they are driving change in their organizations.
Hello, everyone, and welcome back to my podcast. This is Patty, and it is my great privilege and honor to introduce my special guest today, Tom White, founder and CEO of Phynd. Tom, thank you so much for setting aside time, and welcome to the show.
Hi, Patty. Thank you for having me on the show.
You're most welcome. So let's dive into this. Maybe you could start by telling us briefly about the company and its evolution and what the marketplace need you're trying to address.
Sure. So Phynd Technologies is a little over 7 years old. The core thesis that we started with is still the same concept, in that we believe that healthcare systems need a central hub of provider information that can flow into their clinical, marketing, and claims systems that keeps everything in sync from a data perspective, but then also enables output into areas that can drive consumer experience and better operations through better provider data. And so the market need that we really focused on was that EHRs are fantastic in managing the patient journey, but not designed as much to focus in on the providers themselves. And providers are really defined as people, places, and services. So it's a broad term that means that basically it's the products that a healthcare system can offer out to the consumer population. So it literally is the doctors, it's the locations, even, nowadays a COVID testing site would be a place, to the services that a healthcare system can offer, whether it's telemedicine, e-visit, virtual visit, those types of things. And that historically hospitals have managed data on people, places, and services in different places. EHR, from a clinical perspective, marketing typically has their own that drives their patient engagement strategies. Claims has their own system, their own database. And so what we've done is we've merged everything into one profile. So following the Epic model of one patient, one record, we really focus in on one provider, one profile. And that profile can be people, places, and services.
That's interesting. You're right now in the middle of a very exciting time and a transition for healthcare. COVID-19 has accelerated telehealth adoption and virtual care models. So I imagine that the need for, the ability to go online, triage your own symptoms, find a provider, and schedule an appointment, all of that is coming together in a way that potentially is beneficial for a company like yours. And I want to kind of explore that a little bit. At the same time, many health systems are also having financial challenges because of the unexpected costs of COVID-19. So can you talk a little bit about the market environment, how that has changed for you from pre-COVID-19 to now, and what does it mean for Phynd in the marketplace now?
Yes, we've seen an acceleration in interest from prospects, from across the country, because of what the first item you mentioned. That you talk a lot about it, and our clients do too. That there's a digital front door ecosystem, whether it's symptom checkers, smart wait list, appointment reminders, self scheduling, provider search, all these different things. That ecosystem is certainly right now very, very practical and useful, and it's really being adopted, across the industry. What all those different layers of different systems need is a provider data solution, of this central hub idea, back to the original question, of provider information, of people, places, and services that can feed all these different types of systems. Because there's lots of vendors out there, and hospitals are looking, it's competitive. So there's a lot of startups, and hospitals are looking at buying different types of solutions. But what they need at the bottom of that foundational level, is this provider data management platform, this central hub that kind of feeds those. And so we're seeing a lot of interest in what we do, because it really is that basis for the DFD. And, we've talked about it a little bit in the past, that it's, we call it the digital house. we're the foundation for that house. The front door is the website and the consumer experience. But that notion is going to change and shift as patient engagement tools get adopted. So whether it may be the website for the narrow network that the health system's partnered with. It could be a pop-up microsite on COVID testing tents that are in the city. It could be a payer healthcare system partnership website, really exposing kind of what some value-based care entities, whether it's an ACO, CIN. And so the notion of a digital front door, we think, is going to be expanded to include windows and other door, a front door, back door, windows, and all those kind of fun things. And the house framework itself is the provider data that's going to feed those different types of systems. And then you've got apps, you've got mobile applications, which we think, everything's going to end up being kind of done on your phone anyways.
That's a very interesting way of looking at the digital front door concept. And I agree with you that there is no single universal definition of digital front doors. It means different things based on the context, based on the entity, and so on. And of course, you're obviously approaching it from the point of view of provider data. The patient data is the other side of the coin, which is also something that health systems are focusing very heavily on in order to get a unified view of the patient. So all of this is converging in a way that I think is going to make for some very interesting times for all the companies that are active in this space. And that actually leads me to my next question to you. Where do you see yourself in the context of the entire ecosystem of solution providers that operate in this whole space that, for want of a better term, we call the digital front doors? Is the EHR, you've got the EHR companies, Epic, Cerner, and so on. You've got the big tech firms who are trying to have some kind of a play in this. And then, of course, your compatriots in the digital health ecosystem. Where do you see yourself, and how do you see yourself kind of maximizing your opportunity in the coming quarters?
Yeah, so we see ourselves side by side with the EHR. We sit next to Epic or Cerner in that we integrate bidirectionally. We're a deep partner with both of them. We have unique applications on and provider enrollment with those systems. And so as the clinical area is engaging with patients, they need provider profiles to actually run the claims and do care coordination. And that we act as the backbone, again, the central hub. And so the provider profile flows from Phynd into the EHR when the patient encounter starts, if that provider is not inside the EHR already, which they're typically, about 20% of the times that they're not in the EHR. So if they're in the EHR, that data is being essentially managed inside Phynd, and it's bidirectional with EHR. So what's in Phynd is also in the EHR. If the provider's not in the EHR, which happens again about 20% of the time, then we've embedded ourselves in the EHR workflow so that the registration scheduling folks, which are thousands of people in a hospital, can onboard a provider via the EHR, but really using the Phynd platform to pull that data in and create that provider profile inside the EHR. And then once they've created that provider profile in the EHR, Phynd is, we call it an iPaaS. It's an integrated platform as a service. And that once that profile is in the EHR and it's in Phynd, so again, one-to-one relationship, then the Phynd application is used across the enterprise. And one of our clients, we have 12,000 end users, and those are all staff inside the hospital systems that are changing data on the providers real time inside Phynd, and then that's updating Epic as an example, or Cerner. But then it's also going downstream to the marketing team to give them the updates. So marketing knows what the latest information is in the providers that they're publishing out on their website or websites. And then it pushes down into claims so that when the claim when the claim is processed, that the hospital system actually gets paid faster because they have better data in the system on the provider itself.
Are you therefore looking to become the single source of truth, if you will, for provider data?
We are. It's the single source of truth. It's a touchy word. I guess it's a political word. in that, credentialing, they manage the privileging and the onboarding of privileged doctors into the hospital. So they are the source of truth for that process. Whereas from a clinical side, the EHR typically is the source of truth for certain parts of the record of the provider. And then if you look at marketing, marketing's they're going to have their own, their own information, whether it's a bio, video, clinical taxonomy, those things. That is the source of truth for marketing. So we don't want anybody to think that we're replacing what they do from a process perspective. But what we do is we integrate all that data into one profile. So there's one profile on you, for example, that would have all your clinical information that's relevant for Epic, all your credentialing information that's relevant for the credentialing system that your hospital uses, all the marketing data, and all the claims data. So everything's managed inside one profile. And then what you can do with that, because you've got it down to one location versus 20 different silos, which is the way it works now, is that you can then point that profile to different things to optimize the operations of the healthcare system. You can make Epic actually work better. You can make marketing have a better search for the providers and scheduling experience for the consumer. And then on the claims side, you can get claims paid faster.
Yeah. So then who is your primary target audience within a health system? You mentioned so many different stakeholders. So is it the chief marketing officer, the chief patient experience, chief medical officer? Who is it?
It's a great question. So it's the CIO is always involved. And, some of your past guests on your podcast are clients of ours. And, so it's CIOs, it's CMIOs. It's certainly marketing. It's the marketing officer is heavily involved as well. But it's in a lot of ways, it's a technology purchase, right? It's a data platform that transforms the healthcare enterprise, and it can make marketing a lot better. But it's interesting, in the market, there's been a lot of vendors in the market for a while that have made marketing focused solutions. And we think that those were good transitional technologies. But as the pandemic happened, and as healthcare systems have focused in on the notion that fewer vendors doing more platform-focused concepts like what we do, we think that it makes sense for healthcare systems to really look at things like Phynd and say, how can we optimize and operationalize provider data across clinical, marketing, claims, these different areas, versus having these independent systems. So we end up selling to everybody. We in a typical environment, we'll have the CIO in a room, even CEO, CMIO, Chief Marketing Officer, certainly Chief Digital Officer as well. We have a lot of those clients. Because we speak their language, we kind of talk to all of them at the same time.
Yeah. So what do your kind of sales cycles look like? And, I don't want to go too deep into this, but we talk about economic buyers and technical buyers and all of that. And I got to imagine that you have to get multiple stakeholders on board before somebody signs your purchase order, right?
We do. Yeah. So it's enterprise software sales. So our sales team is an experienced, professional, consultative team that focuses in on the issues and the problems that our clients have. So we don't really, yes. I think the sales cycle can be 4 months. It could be 12 months. It could be 18 months. It just depends on where the client is. We don't get a lot of no's. What we get mostly is when we're ready, we'll come back to you. So I think that it's just a matter of time that this notion of this digital house and, the digital front door certainly has accelerated some conversations we've had. The Epic relationship and the EHR relationships are accelerating right now because it's interesting. A lot of our clients, when the pandemic happened, they said, well, we need to bring back retired doctors, nurses, and all these folks that were not in the day-to-day healthcare workplace, right? They said, how can we find folks that are either retired, maybe taking a sabbatical, those kinds of things? We have all that data, right? So it just depends on the event or the opportunity to really say, hey, we really need provider data front and center in our core IT strategy. We're just standing up right now a micro site for one of one of their biggest clients for all their COVID testing tents, because those testing sites move, based on where the hotspots are in their geography. And right now, there's no way to go for a consumer to go to their website and say, show me where they are today, or where they were yesterday. And so with Phynd, you can real time say, okay, we want to show these 20 or 30 different tent sites, and we want to show the hours of operation, and we can extend them. They can change those hours of operation and publish that to their website, at a moment's notice. So they can really expand the offering to consumers, just like what you're used to when you go to Nordstrom's or any other kind of retail operation that's really consumer focused. We're helping our clients do that right now. So back to your question, the cycle is based on the need and the event of our clients, but we think there's a universal need for it. It's just a matter of where they are kind of in their thought process.
Very interesting. So switching gears here a little bit, Tom, the digital health ecosystem has been receiving billions in VC money over the last several years. By all indications, it is a thriving ecosystem. There's a lot of innovative products that are coming out, such as yours. And firstly, I'd love to get your thoughts, or at least for the benefit of our listeners, and how you're funded. Are you VC funded? Are you willing? Are you in a position to share any of those details, just to get a sense of what your profile is, what Phynd's profile is, and then
sure.
In general, what do you see as the opportunities and challenges for digital health startups in light of, especially in light of COVID-19?
Yeah, so we're VC funded. We have traditional kind of tier one VCs in Phynd, but then we also have some health systems as investors. So Memorial Care out of Long Beach, California. So it's the system that runs from LA down to San Diego. They have an innovation fund. They're a significant investor in Phynd. The UNC, so University of North Carolina healthcare system, they have a venture fund. They're an investor, significant investor in Phynd. And so is Orlando Health as well. When we did our funding, we said, let's blend together both top-notch kind of VC operational experience with top-notch healthcare strategic experience and on the board level. And so every board meeting is really interesting because we get both the VC, traditional VC input around risk, finance, operations, and then the healthcare side really driving into things like what we're experiencing right now and what's happening to them, because we kind of get access into what their CEOs and their boards are talking about, triaging their own business over the last couple of months because of the lack in revenue, because of elective surgeries and all the things that you've heard about and talked about. We're really happy with our mix of investors. Up until the pandemic, there's been a tremendous amount of investment in the patient engagement area, and there's a lot of great solutions that are out there. And I do think that there needs to be a coming together of them. There's just going to be too many choices for healthcare systems to have to kind of weed through to buy things. And so I think that there's got to be some level setting eventually, whether it's consolidation, M&A activity, or partnerships as well, obviously, that could help. But there's going to be some consolidation. There's just, there's just too many vendors kind of chasing some of the same ideas, I think, right now. Uh-huh. And, we help our clients we're agnostic when it comes to other vendors. And so we'll integrate with any of them. But they're certainly asking us a lot of the questions I bet you get asked a lot too, as well as, there's 5 people that do this one thing. How do we differentiate amongst them?
Well, that's kind of what we do. That's kind of what we do as a business. We really help our clients sort through their technology choices when it comes to implementing the digital roadmap. But we start by helping them figure out what the roadmap even needs to look like for them. Right? And then we go to the technology layer and then the actual partner selection process. But you're right. That is certainly one of the questions that we get asked a lot because, there's so little public information about many of the startups, and there's not a lot of evidence either, especially if you're a young startup and you don't have a whole lot of clients, and but you may have a great product. Then, what are the risks and rewards involved here, and how to manage them? All of those become, very interesting questions in the context of digital health. These are questions they would never ask if they're talking to one of the big tech firms, because there's a whole different set of questions there. Let's just, we're coming up to the close of our time here, Tom. I just want to get your thoughts on what the emerging healthcare experience looks like for regular consumers like you and me. And what are some of the emerging technologies that you think are going to play a big role in that experience of the future?
I think that the future is bright for consumers. What our clients are doing and what my local healthcare system is doing. I mean, they have an app that I can message my doctor, my PCP. Right now, I can do e-visits. Those are all great starting points. I do think that they need to get deeper into digital diagnosis. That there's that mystery in science about healthcare where you think you either have a common cold or you're really sick, right? And it's like people tend to get, they tend to be hypochondriacs, right? They kind of teeter to I'm really sick when they may not be. And so this notion that the industry should do a better job of saying, no, you can do a digital diagnosis and that you've got a common cold or whatever it may be. So kind of really taking some of the mystery out of the diagnosing certain issues. I do think that the digital front door and the technologies will hopefully expand the learning and the use of consumers across the board. There's just too many phone calls, right? I mean, I don't know what your experience is, but I still have to call into my providers sometimes, not my PCP, but other providers to schedule whether, to colonoscopy or whatever, radiology exam.
Yeah.
And those things need, it needs to flip. I'd say that, 80% of healthcare is driven on phone calls and 20% is digital, and needs to be 80% digital and 20% phone calls.
That's so well said. I think that is the headroom for growth. So if you were half empty or half full, you would look at it differently, I guess. But that whole picture there that you just painted, Tom, that's kind of I see that as the opportunity landscape, and just inverting that mix and going from 80% phone calls to like 20% phone calls. That is the holy grail, I imagine. And I hope that we see it in the foreseeable future. And I'm kind of confident companies like yours are going to play a big role in that, I guess.
Yeah, I agree with you. I think that we will see it. I'm a glass, half full person in general, and just being a startup person, it kind of comes with the territory. The other point I want to make just before we kind of move off that topic is that that interoperability integration is key. We talked about a tremendous amount of patient engagement vendors that are coming to market, and that you have to be integrated into the IT topography, the landscape. So the data has to be bidirectional, has to create this feedback loop. So if you're doing digital diagnosis, what are people asking about? What are conditions? What are the hot spots as far as illnesses? And so this notion that this digital data feedback loop needs to be there. And so I just think that's important for when health systems are looking at vendors that they ensure that it's a bidirectional into their core clinical systems, because the idea is better patient care. And so you just need that data feedback loop.
Yeah. I feel just a couple of quick observations from everything you said. I generally tend to like startups, especially digital health startups, that have a very focused offering and they go deep into it and they do it really, really well, as opposed to a company that might want to do like multiple things and not do any of them really well. And so I think the opportunities, I'm a half full kind of a guy. I'm an entrepreneur, like it kind of comes with the territory. I feel like the digital engagement touch points in a typical consumer journey today are not only many, but they're also expanding, right? A year ago, you might have thought of 10 or 12 touch points that you would consider high priority focus areas or opportunity areas. Today, I can name 25 or 30 such touch points. And who knows, a year from now, there may be 60 high value, high impact digital touch points. And in an ideal situation, you would have a handful of companies that do exceedingly well in one of those touch points. And that is what would open up the opportunity landscape for buyers, namely the health systems, in order to really transform the experience of healthcare. Because today, I think part of the challenge also is that, to your point, a lot of people are pursuing the rainbow, which is, if somebody thinks that triaging is the cool thing or COVID-19 is a cool thing, you got to pursuing it, but you got to really take a step back and commit yourself to the longer term and pick the spot for you and go deep into it, and you're more likely than not to come out successful. But it is a long, hard journey. And Tom, you're a serial entrepreneur, so you know this.
Yeah, it's a journey for sure, and it's definitely a movement. So I think that the industry is moving in the right direction, but it's going to be a long-term process, and it's going to be great for consumers. So I'm excited as a consumer of healthcare. I'm excited for that.
Yeah, awesome. Hey, Tom, what a pleasure speaking with you, and thank you for getting on my podcast. And look forward to staying in touch and following the progress of Phynd, and all the best to you and your team.
Thanks, Patty. I enjoyed it. It was fun talking.
We hope you enjoyed this podcast. Subscribe to our podcast series at www.thebigunlock.com and write to us at info@thebigunlock.com.